Hello, and welcome to Your Health Unfiltered. My name is Alexis Johnson, and I am the co-chairman of Alpha Kappa Alpha Sorority Incorporated Tau Beta Omega Chapter's Gen Next Committee. We are in for a treat today. We have curated a panel of some of Tau Beta Omega's own healthcare professionals to talk about their career journeys, common misconceptions within their fields, and some practical guidance for us for maintaining our overall health and wellness. And with that, I will pass it to our moderator, Andrea Thornton Bolden.
Hello, everyone. My name is Andrea Thornton Bolden, and I am so excited to be moderating our healthcare webinar, Your Health Unfiltered. I am joined by my fabulous sorority sisters from Tau Beta Omega chapter, starting with Dr. Misha. Would you mind giving your full name, the medicine you practice, and what inspired you to pursue medicine?
Hi, thank you, Andrea, and it's a pleasure to be here. I'm Misha Ellis. I'm a clinical and forensic psychologist. And what drew me to the field was generally a curiosity about people and why they do what they do. And that led me on this huge adventure.
Wonderful. Thank you so much. Dr. Lisa, would you mind sharing the medicine you practice and what inspired you?
I hope we have enough time because what inspired me is a convoluted type of pathway to medicine for me. Anyway, I'm Dr. Lisa Richardson and I practice college health. I'm a trained pediatrician adolescent medicine specialist, but college health has expanded. My eldest patient was 74 years old. So I see a plethora of different age ranges in clinical practice. And I really started off in medicine because I wanted to help the population in general to have good access to healthcare. I've done some traveling in the past to different countries, and I realized not all countries have the same medical care that we have in the United States. So that's really what propelled me to medicine.
Thank you so much, Dr. Lisa. All right, Dr. Tony.
Hello, Dr. Tony Henderson, and I am a dentist in private practice. And I always knew I wanted to be a doctor, just didn't know which kind. When I went to the orthodontist at 13, that's when it hit me. I said, you know what? This is what I'll do. I didn't really care to be in hospitals all day, but I thought dentistry was a way of helping others without being stuck in the hospital and dealing with a lot of sick patients. But I deal with a lot of sick patients anyway.
Thank you so much, Dr. Tony. And last but certainly not least, Dr. Diane.
I'm Dr. Diane Mosberry. I trained at Meharry Medical College and I am an internist. My specialty is internal medicine. I'm currently retired for the last 2.5 years, but I did 25 years in clinical medicine. And then for the last 12 years, I worked as a medical director at a health insurance company. I worked at Anthem Blue Cross. I was not that person who wanted to dissect frogs and that loved science. I chose medicine just because my mother wanted her daughters to be physicians. And so I went along with the plan because I didn't have any better plan. And would I suggest somebody do that? I would say if you love science or you really had a passion for medicine, then you're more guaranteed to love your field because medicine is very hard. But as it turns out, I do love medicine a lot.
An outstanding career. You are each so inspirational in your own way. My question is for each of you to answer. What do you find most rewarding about serving patients and your community?
I am a clinical as well as a forensic psychologist, and what that means is that on one hand, I do work with clients to help them to have more fulfilling relationships with themselves, with one another, as well as with their sexual lives. And so that's one aspect of my practice. Another aspect of my practice is I do evaluations, court-related evaluations for families that are struggling to make decisions about custody. And so they're very different extremes of a similar population. So what's consistent about both ends of it is that it involves relationships, as well, family relationships, whether they're trying to work to keep them together and build them, or whether they're dissolving a current structure and trying to figure life out. And so I find it a privilege to be able to step in and work with families and couples and individuals at their most vulnerable times, and in a way that they can fully be present without judgment. And so I help to hold space for them as they traverse some really difficult points in their lives and in their relationships. And so I find it deeply rewarding to be able to journey with my clients in whatever way or capacity I'm working, because I'm helping them understand themselves or their dynamics better, or helping others make important decisions that will have impact on families and children.
That is a fabulous answer. Thank you so much, Dr. Misha. Dr. Lisa, what do you find most rewarding about serving your patients and your community as a clinician?
What's very rewarding for me as a physician is to help my patients go on their healthcare journey with them. I am lucky enough to be able to educate my patients at an early age where they can really make good preventive care and good decisions about their health to thwart or mitigate any factors that they might have that will lead to an onset of a disease process. I always tell my patients, we can't change our genes, but we can change our lifestyle. We have so much power within ourselves to really enhance the quality of our life. And when we enhance the quality of our lives, we can enhance the quality of others. So, by working on a college campus, I feel that I'm there to help them on this journey. And then I see their successes. I see them academically succeed, personally succeed, and in a healthcare fashion, their whole overall wellness. And that is such a privilege. In terms of the community, I do a lot of mentoring. I think it's important to show the community that there are Black physicians out there, female physicians. A lot of times that a lot of patients, they're requesting to see, I want to see a Black doctor. Because there's something, we just have the nuances and things are we don't have to reinvent our story. We know where the patient is coming from. We all have this lived experience, this inapplicable lived experience. So that's one hurdle that they don't have to jump. And then to really inspire young people to get out there in the medical field. Medicine is so flexible. You can do clinical medicine, you can do research. We have our colleagues here that are in behavioral health, mental health, dentistry, our teeth to our feet. We treat everything. So it's just absolutely a pleasure and an honor. So I just want to contribute to our community in that way and just be an inspiration.
An inspiration you are, Dr. Lisa. Thank you. So you mentioned dentistry. Speaking of, Dr. Tony, what do you find most rewarding about serving your patients and the community?
I would say what's most rewarding is when I can relieve someone of their dental pain. I haven't had the pain myself, but I've heard of some of the worst pain you can experience. And for someone to come to me and I be able to take care of them and relieve them immediately, that's rewarding, makes me feel good that I can help others. And also, when I'm able to improve someone's self esteem, say they're not happy with their smile, they don't smile, I can help them out, give them beautiful teeth, wider teeth, straighter teeth, and that will increase someone's confidence. And just like Dr. Richardson said, there are people who want to be taken care of by Black dentists or Black female dentists, and I'm happy that I'm here to give that treatment and help our people out.
Thank you, Dr. Tony. And Dr. Diane, over the course of your career, what did you find the most rewarding about serving your patients and the community?
Well, I think similar to what everybody said in terms of just helping people to achieve their goals. Like, I think physicians, I was an internist, so, um, I had direct contact, like many of you, with the patients. And I feel like you're able to see lives and society from a different lens as a physician. You come in contact with people from all different professions. You come in contact with people, some of them are healthy, some of them are young people that develop major illnesses. Some of them are old and healthy, and some of them are old and very sick. Some of them are struggling to find out what's wrong with them, and they've gone years and years and haven't figured that out. And so I think that it gives you an appreciation of what people endure in life, and to be able to help them make the right decisions in terms of their lifestyle, and help them help make the right diagnosis a lot of times when they haven't been able to achieve that before coming to you, and help them be inspired to practice a lifestyle that will enhance their health is very rewarding.
Thank you, Dr. Diane. All right, this next one, I would love to know what's one health myth online that you wish people would stop believing? Starting with you, Dr. Misha.
One of the things that stands out to me is being triggered. So everybody's triggered, and they believe that when they're triggered, there's no responsibility for their behavior or what they do. And so being triggered is just a state that, we all as humans experience at one point, but it doesn't stop there. Being triggered is just an indication that you need to use your coping strategies. It doesn't absolve you or make other people responsible for coping for you. So that's one of the myths that I really wish people would stop believing.
I love that so much because you are right. It's just like being like, oh, I'm afraid, or I'm angry, or I'm anything. Yes, other precipitating events may have triggered that state, but then you are responsible for what happens next and how you handle those big feelings. Thank you for that wonderful
Definitely.
reminder. Dr. Lisa, same rapid fire question. One online health myth you wish people would let go of.
Um, I see a lot of patients that go online and they think that they know everything because it's online, and one of which is birth control methods. And not all birth control methods are equal, okay? So that if people think that the rhythm method is 100%, there's nothing 100% except abstinence. So I do get patients that sometimes believe that whatever they're doing is appropriate, but they're still at risk for pregnancy. So I would say that is one of the myths online.
And today more than ever, that is an important thing to know because, birth control knowledge is incredibly helpful for everyone to have a firm understanding of. All right, Dr. Tony, one
Yeah.
online health myth you want people to let go of.
Oh my God, oil pulling. Have you heard of that? That's when someone takes either some coconut or some olive oil in their mouth and swish it for like 15 minutes, thinking it's going to stop tooth decay or cure it or stop gum disease. That does not work. Save your oil for cooking.
Thank you so much, Dr. Tony, because I had certainly heard about oil pulling, but I never really thought about like, oh, do I want to try this? I was just like, yeah, that doesn't sound pleasant, but it's very helpful to hear from a professional that it
Right.
doesn't do anything.
At work, no.
Thank you. And Dr. Diane, any myths that you've encountered, or, they can be online, they can be from wherever, where you were like, oh, we need to let this one go.
Well, I see these, there's a Dr. Gundry, and I've never really followed the, be sure and click before this is taken off, but, he talks about the fact that he has read, all the clinical trials and he knows, what is good for you. And to me, I think that people should go to the doctor and let the doctor address it. That and I know that the clinical trials that he's talking about, the quality of the trials, are not the kind of trials that really prove that something is beneficial. You really have to have randomized clinical trials with a lot of patients for it to really be information that is credible. So it just bothers me when I see that.
Thank you, Dr. Diane. The importance of this of scientific rigor, of really like doing the work and making sure all of those processes are in place for a good reason. So thank you for that reminder. All right, now we're going to go to individual questions, starting with Dr. Misha. You were speaking about this a little bit before, but we'd love to have you expand. Social media has popularized a lot of therapy language with terms like gaslighting, triggered, and narcissist being thrown around very casually. From a therapist perspective, what impact does the misuse of these terms have on mental health conversations and relationships?
I think the overuse or misuse of terms such as gaslighting or narcissism or triggered or any other term, it limits the conversations that need to occur. It makes them more one or two dimensional when realistically these concepts are very deep, complex, as well as they don't look the same way for everyone. A lot of times they're thrown around as to either stop a conversation or to try to give life to something. But what ends up happening is that a person doesn't have a real good understanding of what the other person is needing or what they're actually asking for. And so everyone is gaslit or has been gaslit. Like they come into the office frequently talking about how someone gaslit them. And then I ask them, so what did they actually do? And sometimes what actually they're talking about is someone disagreed with me or someone said something mean to me. Well, if I'm going just based on that term and not really understanding how it's being used, then it makes it difficult for me as a therapist or even as like a peer to really be able to step into the experience and assist. And it, in some ways, it cheapens, um, just even the concept. So we're not able to appreciate it anymore. Like, a few years ago, everybody had ADHD or everybody was on the spectrum. It's not to say that people don't have difficulties, but the reality is that for those individuals that really do have difficulties, it makes it much harder to move through the weeds. And, it kind of privileges, some people in ways that really isn't necessary. I don't know if there's a better way to say it, but the misuse of those terms doesn't really help the discussion, doesn't really help the understanding, and really does a lot to limit even our empathy for other people's experiences.
Follow-up question. What could people do instead of trying to like grab onto those buzzwords as they try to communicate their experiences?
I think really kind of tapping into what is happening. Now, that takes a lot more effort, right? Sometimes people are using it for a shorthand, but sometimes they're using it to try to appear as if they know more than they actually do. Or to show that they are aware or in tune. or psychologically minded. But when we really have in-depth discussions, it becomes clear whether or not people realize it or not, whether or not they have a deep understanding of whatever term that they're using. And so I think just slowing down and being more descriptive about what it felt like or what they were thinking or experientially what it was like is probably going to be a lot more helpful and constructive to the dialogue and the conversation.
Excellent. It sounds like slowing down really helps one to both truly assess their intention as well as what it is they are experiencing.
Yeah. And that
Thank you.
allows other people then to really tap in and respond to the place where they are.
Awesome. Thank you, Dr. Misha. All right, Dr. Lisa, you spoke before about your patient cohort being college students, and I love that these days that age runs the gamut. But I was just curious, across your college student patients, what are the most common health issues that you are currently seeing?
I'm going to break my age ranges up like between 20s and 30s and then in their 40s because that's the bulk of my patient population. But usually in my 20 and 30s age range, my patients come in with thinking, like you said, on the internet, let's just say they had chest pain. Oh, I think I'm having a heart attack. Well, not all chest pain is related to cardiovascular issues, particularly in the 20 and 30 age range. So there's a lot of education that goes on. So we see a lot of anxiety related to presumed healthcare issues. So we really have to do a lot of education for our students in this age range so that they can really recognize, what is it that's most concerning and what's least concerning, and then to put everything into context because we can't just assume we have. I tell my patients we go to A to B, not A to Z. We can't go from A and then go on to Z and think we're having a heart attack. That's just not going to happen. So we do, as I said, a lot of education, a lot of preventive care and whatnot. But we're seeing anxiety, particularly as it comes to college students, and not just their academics, but just in the world in which we live right now. So there's a lot of psychosocial issues that we're seeing. Sleep deprivation, it interferes with sleep because anxiety does interfere with sleep. So we talk a lot about sleep hygiene techniques and whatnot. Musculoskeletal issues from prolonged stances at the computer or any screen use. A lot of STDs and family planning issues. So we talk about various issues related with that. My colleague and I started our trans clinic over 10 years ago. So we do hormone replacement and go on that journey with our students too, as well with that. And, we're teaching our students how to be good consumers of their insurance because we are fortunate that most of our students do have insurance. And so they need to know how to work that insurance and know what's covered, what's not covered, and things of that issue. In terms of our 40s, this is when we see most of our chronic disease risk factors becoming a little bit more noticeable. So we're screening more for high cholesterol, hypertension, prediabetes and diabetes, and weight management issues. Um, and then a lot of students are particularly more cognizant of their of different hormones, like in terms of perimenopausal in their 40s, low testosterone levels in men, joint pain issues, and things of that nature. So yeah, we see a lot of plethora of different diseases.
It sounds like it really runs the gamut, which must keep things so exciting and so interesting.
I learn a lot. I learn a lot from my patients. I'm going on this journey with them. Okay.
That's fabulous. Well, the one thing that really stuck out to me, sort of as unifying, is that no matter what step they're at, there's this beautiful emphasis on education, really teaching them about not only themselves and what they're going through, but how the systems that they inhabit work and how that they can work within them. So I think that's really special. Thank you, Dr. Lisa. All right, Dr. Tony, as a fabulous cosmetic dentist in Beverly Hills, you work in a culture where appearance may be heavily emphasized.
Mhm.
We were curious about your thoughts on society's growing pursuit of perfection, especially when it comes to smiles and cosmetic enhancements like veneers.
Well, I can tell you that cosmetic dentistry has brought a lot more patients to the dental office. People care more about how they look than really how they feel. But whatever brings them in, come on. I'm not going to jump right into the cosmetics. I'm going to do what's healthy, what's needed. If you have gum disease, we're not putting veneers in a mouth where your teeth are about to fall out. I'm going to address the foundation first. I'm going to teach oral hygiene. We're going to take care of any decay that's there. And then we'll get to the cosmetic things like whitening or ortho to straighten teeth or veneers. So as long as they're coming in, whatever brings them in, that's fine. I'm going to start at the beginning, and that's with great oral hygiene and a healthy foundation before we get into what looks good. But yes, cosmetics is a big deal here and probably other places. But whatever gets them in the door, I welcome them.
Absolutely. Follow-up question for you.
Mhm.
I know that especially with all kinds of cosmetic procedures, when you're traveling to get work done is, happening now more than it ever has. And I'm wondering if in your practice, you might be seeing people who've gotten cosmetic dental procedures done abroad or perhaps with somebody, not to say that, abroad there are certainly
Sure,
licensed
sure,
and, wonderful
sure,
clinicians there, but
sure.
maybe, somewhere else or even here with people who might say that they're a veneer technician, even though that's, I don't think, a real thing. And
Got
you're
you.
having to kind of come in after the fact. I'm wondering if you're having to deal with that.
No, you do see a lot of people traveling out of the country to get quicker, cheaper work, and that's really not a good idea. I'll give you an example. I have a patient, and she came in for her regular cleaning. And the hygienist came to me first and said, she's in the room crying. I said, why? She said, because she went to Turkey to get some veneers done and she's in a lot of pain. She can't eat, she can't talk. It's terrible. So I go in and I see her, and yes, she went and got all these veneers. They looked horrible. And I said, well, how much did you pay? I think for maybe 20 veneers, I think they came up to 5,000, which is very cheap. And it was very quick. She said she flew to Turkey, and the first day they drilled down her teeth, which we have to do sometimes with veneers. They drilled her teeth down, didn't put any temporary veneers on, which I would do, and let her go home. So they shaved all this enamel off, which exposed her to a lot of air sensitivity. She couldn't eat or drink with that enamel gone. So they sent her home or to her hotel. And maybe 2 days later, she came back and they showed her the veneers. And she said, no, they're too dark. So she made them do them over. She came back the next day and they were too light. But she said, but now I had to leave because I had a plane to catch. So she said her bite was off. When she bit down, only one tooth was touching. So you can't eat with one tooth touching. And I think she called them to complain, and they said, if you need any corrections, you have to go to, and they named another country. And I just thought that was crazy. how can you go to another country if and you may need follow-up? And you really get what you pay for. I've never sent a patient home without a temporary veneer or a temporary crown. That's just inhumane. And so she couldn't bite. The veneers didn't fit well. I adjusted her bite as much as I could. I sealed in some spaces. Well, they would remove enamel, but not even cover it up completely with the veneer. So I had to do a lot of repair work. And I told her, all this has to be done over. And really, her teeth, her own teeth, weren't that bad. They weren't that bad, but she was in there crying. She regretted that she did this. I said, well, the good news is you only spent $5,000. That wasn't bad. That's the good news. But the bad news is this all has to be done over again. I've seen it many times, getting bad work for cheap out of the country. And maybe there are some great dentists that can provide that treatment, but I wouldn't trust it. I wouldn't trust it at all.
Dr. Tony, thank you so much for sharing that. That was an incredible wealth of information that the people need to hear. So thank you. Dr. Diane, because I haven't gotten to you yet, I'm going to ask you the next question. Across your career as an internist and the work you did in healthcare, what are some preventative health habits you wish more people had prioritized earlier in life?
Three things. One, exercise is very important. Everybody needs to exercise at least 2 hours per week. If you can do more, that's better. So let's say 2 hours, well, 1 hour twice a week, or 2 hours once a week. Ideally, half an hour every day, but definitely exercise. Second is eating correctly. And the third is stop doing habits that are bad for your health before they cause disease. And by this, I mean, like, the main bad habits are alcohol and cigarettes. And actually, eating can be a bad habit, and I'll give you the context of that. But I would say that if you know, if your drinking is just a social drink when you go to a party or when you're socializing, or if your drinking is something that you're doing when you wake up in the morning, and when you start drinking when you're at a party, you can't stop. So if you feel like it's a problem and you know it, stop it. You don't need to wait until you have liver disease. You don't know when that'll occur. Will that occur in 5 years? Will that occur in 20 years? But whenever you feel like your habit of drinking is a problem, then you need to stop it. Obviously, cigarettes is simple. Nobody needs to smoke. And with eating, I would say, everybody looks at eating like, oh, it's one of the joys of life, which it is, absolutely. But if eating is bad for you, if you have diabetes and you're not supposed to eat this, or you have high blood pressure, and just because you take the medicine to control your blood pressure, that doesn't alleviate you of the responsibility of not eating salty foods. And you know that if you're very overweight, that you can't eat cake because it's going to cause a problem with your health. Because being morbidly obese will cause a lot of health problems. So just getting rid of the bad habits before you feel like you have to.
Thank you, Dr. Diane. Going again to Dr. Misha. Dr. Misha, it is May, and thus it is Mental Health Awareness Month. I was wondering, what are some healthy ways that we can manage stress, burnout, and anxiety in today's world?
Yes, each one is a big part of our lives, realistically, or risk that we're confronted with because We are living in very stressful times as well as stressful life periods, right? As Dr. Lisa mentioned, like people come in different phases of their lives and there are different challenges associated with each. But one of the things that I think is helpful for people to be able to recognize is that mental health or behavioral health or emotional health exists on a continuum. And so, I think one of the things that's going to be helpful in being able to manage stress, anxiety, or burnout is just to kind of recognize uh, that their symptoms do exist on a continuum. And if they feel like those symptoms are getting in the way of them being able to engage in daily tasks, whether that is engaged with loved ones or friends or complete work or sleep or eat, that's an indication that they're probably going to need some assistance to help with their coping, and it may be helpful to reach out to a professional. However, if they're on the lighter side of that continuum where they're experiencing stress, stress is a regular part of our lives, but being able to manage it involves utilizing a number of different strategies. There's not a one size fits all. And so tapping into their support system wherever that may be. We live in a time where we're able to do that in much easier ways than we were able to when I was younger because we have the internet, we have social media where we can talk to our friends, not look at stuff, but, where we can communicate with people. We can use Zoom. We can use a number of different methods to stay in touch and contact with people. And we can actually meet with people in person because that's important too. So tapping into our support systems is important. Additionally, engaging in some kind of regular body movement or engagement is really helpful with being able to put things in perspective. Like exercise or dance or a number of different activities, they do a number of different things, right? They help us to kind of feel connected to our bodies, but additionally, it helps us to be able to, um, uh, kind of get rid of energy physiologically, right? But then there's also room for nutrition, sleep, as well as consulting with professionals, whether they are peers or professionals like myself. I think utilizing all of those resources helps one to be able to determine when stress has gotten to a point that they're not able to cope with the strategies that they have productively, or if one is feeling burned out, being able to recognize that it's burnout as opposed to just fatigue. There's a difference between the two. And there's a continuum as well as with anxiety, right? Some worry is natural, right? So if I'm going on a cruise and they're saying there may be a storm, you know, being a little concerned is normal. But if my concern gets in the way of me being able to enjoy or has me checking or really uncomfortable, then that's problematic. And so I think being able to utilize the wealth of strategies helps to protect us, provide a protective barrier, but also helps us to know when, if those aren't working, we need something else constructive. And so, yeah, those are the best ways to really try to manage each one of those. And yeah.
Fabulous. That is an incredible wealth of information. Follow-up question on just one part of it. You spoke about moving out sort of energy physiologically. And
Mhm.
I know that these days people can think of the mind and the body as separate, but you know more than anyone that it's all the same organism.
It is.
Can you speak more to that mind-body connection and how movement can impact mental health?
Yeah. So our minds are inside our bodies and they're not they're not separate. And so the way that we think researchers found that the way that we think has an impact on our bodily functions, on how we experience pleasure, how we experience pain. For example, I won't belabor this too long, but there was a research study that was conducted that looked at women's reactions to shock. It was an experimental study. And so what they did was they looked at conditions, right? And what they found is that when there was someone in the room with them, their experience of the pain was lessened than when they were alone. If they were with a partner and were holding their partner's hand, their experience of that pain was even less. And so when we think about just being able to utilize just movement to help with our sense of well-being, it's really powerful because one of the things, like say, if someone is like significantly depressed, the first thing that a clinical psychologist is going to do is not say, please think differently. You shouldn't be depressed. Instead, what they're going to ask them to do is to get engaged in life. So do some of the things that they used to do that they found enjoyable, even if you don't feel like it. And by engaging in that, it takes their attention off of the thoughts that could be consistently negatively impacting how they're experiencing things, or that makes them feel worse and worse and worse. And instead, what it does is it helps to move them into the present moment. And I find it really powerful because I actually use it myself. Like I am loving a certain kind of dance right now because when I'm in that dance class, I need to focus on what it is that I'm doing. And it makes, like any stress that I'm experiencing, it puts it in perspective, right? And in that moment, if I'm fully engaged and present in that activity, then I can't spend time worrying about what I was worried about before. I'm in this space. And when I leave that space, it allows me to have some distance from the issue and be able to potentially see it from a different perspective. And so that's one of the things that somatic exercises can actually do. And somatic just basically means it has to do with your body. And one of the things that we know is that healing comes, we've been created, in this physiological system that, one thing doesn't necessarily cause healing. It all works together, and there are multiple ways to work towards healing.
That was awesome. Thank you, Dr. Misha. All right, Dr. Lisa, my next question for you. You were speaking earlier about the incredible educational component when it comes to serving your patients of your college students. I was wondering, is there any education or advice you can offer them and us on how patients can best advocate for themselves during their medical appointments?
That's a really good question, because all patients should be able to advocate for themselves appropriately and not feel guilty or be Mrs. Nice Person when you go into a visit. Um, the United States, our healthcare is a system. And unfortunately, in the United States, we have a long system of systemic structural racism. So it's even more important for our historically marginalized populations to advocate for themselves, because there are certain things that might be dismissed when they're talking to their clinician. The clinician should be on that journey with the patient. So the patient should come in and um, be prepared. First of all, be prepared. They should ask questions. They should do their research before they even come in. I often ask my patients, so what, I don't even say what question, do you have any questions for me? I say, do you have 3 or 4 questions? So they know that they can ask me more than just one question. Um, they have to realize too that they are on this journey and it has to be something that is realistic in terms of their shared treatment plan. So if there's a treatment plan that is just not going to work based on their lifestyle or what have you, that's not treatment plan for that patient. So you have to be creative and tweak it to make sure that that patient it gets the appropriate care that they need. And then patients should be aware of the risk and benefits. The risk of doing something, the risk of not doing something. So they need to be highly aware of that. And if they need to bring somebody with them, bring somebody with them to their visit. Oftentimes, I know the room is small, you only have a few minutes. Really, when you think about it, a clinician only has about 7 minutes with you. So that's why you really need to come prepared. But if they have somebody there that can advocate for them with them too, as well, that's helpful. But they should, I always tell my patients, come prepared, write down the questions. You can give me questions afterwards. And then our patients are pretty savvy, know the political scene that's out, know the different nuances to all these political new laws that are coming out or what you need to know in terms of your rights. And then you can have a copy of your chart too, as well. You can access your chart, you can access your labs. And if you feel that clinician is not meeting your needs, get another one. There's more out there. Do your research with that too. Don't take no for as an all and be all. Get another clinician that can work with you because you have to have a good rapport with your clinician. I won't know if you don't tell me. So they have to have a good rapport with your patients, with the clinician.
That is fantastic. I'm going to try to restate some of this to make sure that the folks at home, are getting it. So come prepared with questions. And I love how you said in your appointments, you're like, do you have 3 or 4 questions for me? I mean, that's just mind blowing. I can't having a doctor take that time. So come prepared with your questions. If you need someone to be in there with you, do not be afraid to have that. That is your right. Be savvy, about what your rights are. Know that you can ask for your chart, you can ask for your labs, any medical data that has to do with you. And you can always get a second, third, and even fourth opinion. All right, Dr. Tony, I have one more individual question for you.
Mhm.
And that is, what does a healthy smile mean to you beyond aesthetics and appearance?
Healthy smile. I'll go back to the foundation, which are your gums. And well, it's not really your gums, it's the bone underneath your gums. So we have your tooth it consists of a crown and some roots. The roots are embedded in your jawbone. So you want healthy bone that will hold your teeth in your mouth. When your gums and your bones, when they're not healthy, you get a lot of bleeding. So if someone's brushing their teeth or flossing and the bleeding starts, it's because you have gum disease. And some people think, oh, when I floss, I bleed, so let me stop flossing. That's the opposite of what you should do. So a healthy mouth, gums do not bleed when you're brushing or flossing. Also, you want teeth that don't have any holes in them, that don't have decay or missing fillings. Every tooth should be intact. It doesn't matter if it's a front or a back tooth, because often I hear, well, I don't need to fix that tooth, it's in the back. No one can see it. And I have to tell them teeth are not for seeing, they're for chewing. A healthy mouth consists of a full complement of teeth. All your teeth are there for a reason. It's not okay to lose this one in the back. You need the back teeth for chewing. So we're talking cavity free teeth, healthy gums that aren't bleeding or they don't hurt, full complement of teeth. So that's healthy to me. No pain, no bleeding, and teeth without holes, and we don't want any loose teeth. So that's healthy. No bleeding, no pain.
Thank you, Dr. Tony. I was I was laughing at myself when you were like, when you floss, it shouldn't be bleeding. I was like, so I've been told.
Yeah, and if it's bleeding, go do something about it. And that something is not stopping with the floss because that's just going to make it worse. It's bleeding for a reason. Find out what it is and do what you're told to do, and that's brushing and flossing daily,
Thank you so much.
along with cleanings at least twice a year. Cleanings twice a year, even if you think you're healthy. Some need to come in more often, but at a minimum, everyone should go twice a year, every 6 months.
Thank you, Dr. Tony. Fabulous reminders. All right, ladies, doctors, I have one question left for everyone. And this is going to be a beautiful, quick, and easy. You all have been amazing. This has been such an incredible, incredible wealth of knowledge. All right, for my last question, what is one action item that everyone listening can take this week to improve their well-being? Starting with Dr. Misha.
The one thing I think that people can do to improve their well being is to take slow, deep breaths. I think one of the things that you've heard across people is that, you hear about mental health issues popping up in physician offices or dental offices, etc. And sometimes just taking a slow, deep breath helps you to kind of slow down and reorient. So,
Thank you, Dr. Misha. Dr. Lisa, one action everyone can take for their well-being.
Forgive yourself because every day is a new day and you're not going to get it right every day. And there are other opportunities to do better each day. So forgive yourself for whatever it is that you didn't do, that you wanted to do, or you did it wrong, or you didn't do enough of it, or you did too little of it. Move on, learn from it, forgive yourselves, and believe me, you have another opportunity to do better.
Oh, that hit me in my spirit. Thank you, Dr. Lisa. Incredible. Dr. Tony, one action people can take for their well-being.
I would say if you don't have a dentist, you need to get one. If you have a dentist that you haven't seen in the last 6 months, make a phone call and schedule an appointment. And, even if you don't go on a regular basis, having one is important because, say, you do have a toothache and if you don't have a dentist to go to, what are you going to do? You're going to call some friends, maybe get a referral. Maybe that person can see you, maybe the dentist can see you, maybe not. But as long as you have an established relationship with the dentist, you're in better shape. So if you don't have one, get one.
Thank you so much, Dr. Tony. All right, Dr. Diane, what is one action that everyone listening can take to improve their well-being?
I think that everybody should try to find that exercise, whatever it is that excites them and that they want to do, so that they will do it. And many people, I actually started exercising when I got into my 50s because I said, oh, I'm getting older, so I better start exercising. And found, oh, suddenly I slept better and I felt better. And so, everybody needs to exercise.
Thank you so much. This was, again, so incredible. We're so grateful for the work that each of you do, for your community, and so grateful that you can help all of us live healthier lives. Thank you.